Hi, it's Dr. Pryor, and I'm making this video this week about naturopathic medicine, and what a better week. It's Naturopathic Medicine Week. So what this video is going to cover is the difference between conventional medical doctor school and naturopathic medical school. And a reason you might want to watch this throughout is because I will cover what classes and what things we learn in naturopathic medical school, so you can see what to expect if you've never been to a naturopath, because we have a lot of tools in our toolkit. So let's get started because it's a lot. In undergrad, it's the same requirements: chemistry, organic chemistry, physics, biochemistry, calculus, all those fun classes. You then apply to the medical school. They want to see your test scores. They want to see volunteer hours, work experience, social engagement, anything you were a part of like research. If you get accepted, they're both 4-year medical schools. Even in the first 2 years, they're pretty similar in classes you take. You have classes like anatomy and physiology, or you have a cadaver lab that you cut open and you look at the organs. You have classes called neuroscience and genetics. You have pathology. You have CLPD, which teaches you how to diagnose. Lab diagnosis lab, where you learn about different labs. A lot of the same classes in the first 2 years. In the first 2 years, the main difference is they learn pharmacology because that is their main modality for treatment. If you're sick, you get a pharmaceutical agent for that sickness, and that's their treatment. In our first 2 years, we start plant medicine and we start nutrition. We start hydrotherapy and we start counseling. So those are what we start. With plants, we learn a lot. We have a class called phytopharmacognosy, where we learn the active constituents in plants, and those are like alkaloids and saponins. And botanical medicine lab, where you learn how to make tinctures and ointments and salves. And nutrition is just the first one, and counseling. We really cover something called motivational interviewing, how to basically get people to make lifestyle changes. In the last 2 years, the schools become very different. In conventional medical school, they go through rotations of classes and basic clinics. And basically that's to figure out what specialty they're going to be. And they take these things called shelf exams. In our school, we have a lot of stuff still to cover, so we're in a lot of classes, but we're also in clinic. So our clinic is all 2 years, and we are constantly seeing patients, and we don't have rotations too much because we're all naturopaths. We all specialize in naturopathic medicine. So, in the last 2 years, there's a lot. So I made a list. We take a year of traditional Chinese medicine, and that helps us to learn about the principles like yin and yang imbalances and blood deficiencies and qi deficiencies, so we have a good understanding of traditional Chinese medicine. We have another semester of counseling because we do a lot of counseling in our medicine. We have a class called mind-body medicine, where we learn how treatments for mind-body connection. That's very cool. We have to write a thesis. My thesis was on how does superoxide dismutase 1 cause familial ALS and treatment options. So yes, I'm a specialist in ALS. We have 1.5 years of homeopathy, which is these little diluted substances you take, and they stimulate your V's to get better. We have naturopathic manipulation, which is a whole year where we learn how to adjust the body, basically how to adjust the cervical spine, how to adjust the limbs, how to look at the body for any imbalances, and how to assess the body for things we need to correct with therapeutic exercises we might prescribe. We also have a year of pharmacology as well, because we have to be very proficient at drugs as well, because many of our patients are on drugs when they come to us. Let me just make sure. Oh, and we have to get through 3 years of nutrition, so all throughout, and we learn all about therapeutic diets, how to give specialized diets based on conditions, how to give nutraceutical like glucosamine conjoined for joints and SAMe for depression, all these kinds of nutraceuticals. We have 2 more years of botanical medicine, so we know a lot of plant medicines, and you'll get a lot of plant medicines possibly if you come to us. Yeah, and I think that's about it. I had a whole year of generative medicine. Not every naturopath has this, but I got that specialty. And basically, it's where we take your genetic material from Ancestry 23 and we put it in Opus, and we can get an idea of how your SNPs, what are these little point mutations in your genes that make them different amongst people, how they can be affecting you or make you be susceptible to certain illnesses, and therapeutics to help that. We also learned how to make specialized diets based on you, and we also have Utopia, where we can plug in your data from stool tests and really figure out ways to manipulate the bacteria in your gut to make them more or less compete with each other, all that kind of stuff. So a lot of tools in my toolkit. One thing I missed, we have a class called Physiotherapeutics, where we learn how to put on TENS machines, all kinds of e-stim machines, how to do ice treatments, how to do all sorts of different treatments, ultrasound, all that. So, and you come to a naturopath, you can expect to have any of or all of these things that we learned. So I hope you learned something, and I hope it makes you excited to come see a naturopath. We are so awesome in use because we have a lot of tools in our toolkit. So thank you for watching, and please, if you could, subscribe to my video. Like I said, I'm going to put out another video next week. You don't want to miss that. And thank you, and have a good night. Bye.